We will get this underway because I want to be respectful of everyone's time. I certainly appreciate the turnout, and I appreciate everyone being here today. Some of you, I'm sure, have come from great distances. I know some of our speakers have as well, or our presenters. And so we will get underway. We'll get the agenda going. The goal is to finish up as close to 6 o'clock as possible. Now, I've done these kinds of things all over the state, whether it's on this topic or others, and usually you go a little over. But that's okay. But if we go a little over and we end at 6:30, that's better than ending at 8 o'clock or 8:30 or 9 o'clock, I'm sure, for many of you here. So with that, I want to introduce, I am Senator Rob Ort. So for those who do not know, I'm a New York State Senator. I represent the 62nd Senate District, which is comprised of Niagara County, Orleans County, and 2 towns, Ogden and Sweden, in Monroe County. So basically right between Rochester and Buffalo is my district. Obviously, I've had, well, I shouldn't say obviously, I've had a number of projects that have been Article 10 projects. I've been in the Senate for just under 5 years, and in that time, I think I've had 5, or have currently 5 projects that are either at some progress in the Article 10 process. And obviously, when you talk about windmills, most of those projects fall under Article 10. And for those that don't know, I'm sure that will come up today. Article 10 is a New York State process whereby over a certain amount of energy production, projects have to go through the Article 10 process, which is a statewide board that makes determinations on whether these projects should go forward. And to my knowledge, there's only been 2 that have gone completely through the Article 10 process. There's been several other projects that have started, stopped. Some projects are currently in the Article 10 process currently. But obviously, we're here today to talk about the public health impacts as it is related to windmills. And I wanted to just address briefly, this past session in the New York State Legislature, we passed the Climate Community and Protection Act. I'm sure most of you in this room at least are familiar with that, I hope, but there's a lot of folks across New York State who are not familiar with that because it was, of course, it was passed at 2:30 in the morning. And it's a significant piece of legislation. Wherever you may be on this topic, or wherever you may even be on the issue of climate change or on the environment or what have you, no one can deny that the impact of this legislation is significant. And in fact, we don't even really know what the full impacts are because the legislation sets the goals, but it doesn't say how we're going to get there. That, and as they say, the devil's always in the details, how is just as important as where you're ending up. How you get there is just as important as where you're going. And that was punted, or in this legislation, in my view, it was given to a board that will meet. So the how is delegated to the Climate Action Council. Now, the goal of the legislation is to get to net zero emissions by the year 2050. Every few years, the council has to issue an implementation report, which is a plan for how we will get to these goals. The plan must include an overview of social benefits from the regulations or other measures, including reductions in greenhouse gas emissions and co-pollutants, diversification of energy sources, as well as other benefits to the economy, environment, and public health, which is what brings us here today. So that's why we're here, to learn about the public health impacts of wind energy. So I'm hoping that there are more of these across Western New York and across the state, because quite frankly, the legislation calls for it. And this is the only way we're going to be able to have I think, a reasonable, fact-based discussion on these projects, because if you live in a rural community, you will see more of these projects, because the goals as outlined by Governor Cuomo and in this legislation, it's going to mandate essentially more wind, more solar, more renewable energy projects to meet the demand, the energy output demand from New York State residents, because the output in many cases isn't changing, but how they have to deliver that is. Coal is going away, as we know. There's been, other determinations as far as energy policy goes. So you're going to see more of these projects. So it is my belief, and I believe Assemblyman Mike Norris's belief, and hopefully all of your belief, that these kinds of forums are both good, but that we need to have more of this public discourse and a chance to learn from people who know this information, certainly far better than Rob Ort or any elected official. There's some folks up here who have dealt with this for many, many years, and I hope that everyone in this audience learns something, maybe takes away something positive from this discussion today. Wind has obviously been a focal point of the New York State climate strategy, and we've seen more projects being proposed, as I said, across Western New York. Advocacy groups have raised concerns about public health impact of turbines, and we would like to get an understanding of what those impacts are. And I'm sure there are people here who are here today in the audience who would be directly impacted by these projects because they may live next door or live in close proximity to these turbines, and certainly their perspective is important as well as anyone else's perspective. I'm joined by a panel of experts on this topic who were recommended to me by different advocacy groups, and we'll have the opportunity for testimonials and hopefully for some questions. So I know we're going to be a little pressed for time, so what I'm going to ask is if somebody wants to ask a question as the discussion goes on, feel free. I don't know if there's slips of paper. Write those questions down, and you can hand them to the very tall gentleman in the back. The tall, lanky gentleman, he works for me, but he will collect those questions. We will submit them, and we will try to get to as many as we can. If we do not get to your question, I know many of the presenters, including myself, are going to stick around for a little bit afterward, and there may also be an opportunity to email questions to the people who are here today, and they may be able to answer those questions at a later time. So the goal is certainly to answer any question that anybody has. If we can't do it right today, we will make every effort to do that as soon as possible. I want to introduce the dais, the panel that we have here today, and then we will get into to the remarks. So as I said, I'm Senator Rob Ort. I'm joined by my colleague in the New York State Assembly, Assemblyman Mike Norris. Mike represents, the 144th District. There's a lot more in the Assembly, so I can't keep track of them all. But I know the areas he represents. He represents eastern Niagara County, so basically Lockport going east, and then he has, I guess, is it the northern portion of Erie County? Northern portion of Erie County. So he has Clarence and Newstead and Akron and that area as well. So, and he's been a colleague of mine for the past 3 years, and obviously much of his district is being impacted potentially or certainly in the future by these projects. And then we also have Dan Stapleton. He is the Niagara County Public Health Director. He is also a member of the Western New York Public Health Alliance Board of Directors, and he is the president of the New York State Association of County Health Officials. So Dan, thank you for being here. Jerry Punch, PhD, audiologist. Dr. Punch holds a PhD degree in audiology, which to me just proves you can get a PhD in anything, right? So, but no doubt he is a smarter individual than me and has been a certified audiologist for over 50 years. He has been affiliated with the Department of Communicative Sciences and Disorders at Michigan State University for the past 30 years. So to have him here is a big deal. He's obviously come from a great distance and obviously brings with him a wealth of knowledge. Although retired from his faculty position, he continues to conduct and publish audiological research at Michigan State University. He has written on the topic of wind turbine noise and human health and has often served as an expert witness on this topic. So I want to welcome Dr. Punch for being here as well. Rob Rand, member of ASA, INCE. Mr. Rand is a member of the Acoustical Society of America and a member emeritus of the Institute of Noise Control Engineers. He has over 39 years of professional experience providing environmental and technical consulting services to power generation, commerce, industry regulators, and communities. So Mr. Rand, thank you also for being here. And then last but certainly not least is Gary Abraham. A lot of people in Western New York should know Gary. He's been an environmental attorney for a number of years. Mr. Abraham is an attorney who practices environmental, municipal, and land use law throughout New York State, including practice before the New York State Department of Environmental Conservation, limited to public interest cases. His current cases oppose proposals to expand major landfills and overly intrusive utility-scale wind farms. So that is Gary's background, and we will hear from him, I guess, more from a legal standpoint. And so with that, I believe this is in order, so our first presenter is going to be Dan Stapleton, Niagara County Public Health Director.
Good afternoon, everyone. Thanks for being here today. Hello, Mr. Beach. How are you today? I'm the Chief Public Health Officer for Niagara County. But today I'm representing a number of groups. Of course, I'm representing the Niagara County Board of Health. I'm also, as Senator Orden mentioned, a board member for the Western New York Public Health Alliance, which represents 8 counties of Western New York. But I'm also serving as the president of the New York State Association of County Health Officials. I've been dealing with this issue for about 2 years. I think I got my first call was from a resident that was concerned about this issue, gravely concerned. So I by no means I'm an expert in industrial wind turbines, but the first thing I do is I don't call them farms. I call them industrial wind turbines. I've met with all of my, I've met with a number of people to talk about this issue, residents of Chautauqua County, Niagara County, Genesee County, and so on, Orleans County. So I felt it was my due diligence to learn more about it. Once again, I'm not saying I'm an expert, but I've learned a lot in the past 2 years since I've been dealing with this issue. And then, as part of my responsibilities as the Chief Public Health Officer for Niagara County, I had to educate my Board of Health. These are lay people, but they're also physicians and so on. So I had to talk to them about the concerns people had. There's nobody on the board that's against renewable energy. What they're against is putting projects together unless there's a very thorough process followed to make sure that this is safe. It shouldn't be incumbent upon the residents to prove that it's unsafe. It should be upon the developers to prove that it's safe. And I think that's what we're trying to get to, at least in Niagara County. So I met with my Board of Health. I talked to the members of the Western New York Public Health Alliance as a board member there, and also I talked to the 58 counties that the New York State Association represents. For most of those people, this is a new idea for them. People from Nassau County, Suffolk, they say, what are you talking about? People from Albany say, what are you talking about? Oh, I say, I'm talking about the concerns that the residents have about this type of issue. So it took a lot for me to be educated. I educated my Board of Health. And all 3 of these entities that I've talked about, the Alliance, the State Association, my board, have all unanimously supported resolutions to say, let's look at this topic first. Let's study it thoroughly. Let's do it in the public. Let's be transparent about what we're doing and make sure we have all the information so we can make a good decision. In public health, we do that every day. We educate ourselves, learn about the issues, and learn how to do things before we do them so that they're done properly and in the right way. So that's something we've done all along. A big part of what I do is I prevent the spread of disease. That's a very important part of what I do on a daily basis, me and my staff. I promote a healthy lifestyle, and I also make sure that we protect the public from health risks and health hazards. And that last one is really why I'm here today, to talk about those types of things, to learn from our experts. Like I said, I'm not an expert, but I'm learning a lot every single day on this issue. I like to say when I go to the public, I always say, if you breathe the air, or you drink the water, or you eat in a restaurant in Niagara County, then me and my staff have helped prevent your family from becoming ill. And that's really what this is about too. This is about making sure that we look at these hazards, we look at these risks, and we make sure that the public is safe, period. It's not a debate. We don't debate. We make sure that the public is safe. And then we take care of those other issues that arise. but I think we may need to make sure we do that. I worry about a lot with my job. Every single day, all the time, I worry about certain things. What I'm worried about is whether a Class A body of water, Lake Ontario, gets contaminated by the fluids, the lubricants in an industrial wind turbine. I worry about that. I worry about the millions of people who use that for fresh water, not only in the United States, but also in Niagara County in the United States. I worry about chronic disease that people might have, chronic sleep disease from sleep deprivation, either not having enough sleep or not having a good quality of sleep. There's documentation that shows the impacts of those types of things on chronic disease. We deal with chronic disease every single day in the health department, without fail, chronic disease. So when we think about something that has been proven through experts saying that it can produce chronic disease, it's very important that I learn more about that. I worry about the unanticipated health impacts, the things that we don't know before we take action. Those are the things I worry about, and I'm sure you worry about that as well. We're talking about a large-scale project. And because I'm worried about these types of things, I have discussed for hours with my Board of Health. I've convinced my 58 fellow counties to support a resolution to make sure there's very thorough assessments done of health impacts and health risks before something like this is approved. I also have dealt with my West New York Public Health Alliance. Chris Schuyler is your public health director in Chautauqua County. So I've talked with her an awful lot. And because this is really important, I'm going to read a little bit about what we've said in our resolutions, because I want you to hear it directly from me. So excuse me for a minute while I read. It is imperative to fully research, assess, and evaluate any health or environmental implications that could put New York State residents and communities at risk as a result of constructing large industrial wind turbines. Local health departments are responsible under New York State public health law for protecting residents' health, so we feel it is our due diligence to support appropriate reviews and testing prior to construction of planned projects. The state must require a complete and transparent process which includes comprehensive environmental impact studies and local input. Those are things we won't debate on. They have to be part of what we expect from our government. It's what you expect from me. It's what you expect from our state representatives. And you should expect that from the New York State Department of Health as well. So that's why I'm here today. Like I said, I'm learning as much as I can. I'm going to learn from more experts today. I'll be here after the meeting if anybody wants to talk to me privately, but I'll be happy to answer questions whenever you have them. So thanks again for having me here. I appreciate it.